Have you ever had to like cross your legs when you're sneezing, laughing, coughing, or doing that little jiggle just so you can make it in time to the toilet? If so, listen up. I'm going to talk to you about why this happens, why it may not be normal, and what you can do about it. This video has been inspired by a conversation by my daughters, who are 7 and 4 years old. And I'm going to share with you a little bit later what exactly it is they said about adults peeing themselves. I'm Remi, I'm an obstetrics and gynaecology doctor, building her health room for you to help you heal postnatally, physically, mentally, and socially, all while optimizing for long-lasting health. I've got a postnatal recovery questionnaire down below because I want to build with you in mind. I want to know what you're going through, where you're at on your postnatal journey, and how I can make content and products to help you recover fully. Why don't you join me on this journey and subscribe to this channel, because I have so much more content coming out just for you. So I've got 2 girls, and every time we go out, I do the regular checks. Do you guys need to go to the toilet? If so, go at home before we go out. Do they listen? Of course not. So I remember specifically one time we were out and I was like to both girls, come, let's go to the toilet. But also I needed to go to the toilet. And often I'll take them, I'll get them sorted, and then I'll go myself. And so the older one went, and then the younger one, and I was doing that little jiggle, crossing my legs, trying to make sure I held it all in. And then the older one was like, adults don't wee on themselves. And with conviction, like I have never seen in her before, my 4-year-old said, well, actually, sometimes they do. And I looked at her and I was like, girl, you are right. Sometimes we do. We do pee on ourselves. And it can happen at any age, but especially after having a baby. And that's what inspired me to make this particular video. Because I know I am not alone, and neither are you. So what is incontinence? Urinary incontinence, to be specific, because you can be incontinent of the bladder, but also of the bowel. And I will cover that in another video. But urine incontinence is where you're experiencing leaking of urine without meaning to. And although it is common, by God, it is common, it is not normal. And it is something that can be treated. There are 2 specific types of urinary incontinence. You've got stress incontinence, so that's where you get that leaking of urine when you're coughing, sneezing, laughing. So the pressure in your tummy is increased and it just pushes on the bladder, and then before you know it, you've had a little bit of an accident. Or there's the other type where you're needing to go to the toilet, and if you don't go right now, then you may well leak before you get there. And so that's called urge incontinence. So I need to go to the toilet, and if I don't get there in time, I am gonna leak. So that's the second part. And of course, because why not? You can have both, where you have the stress, laughing, sneezing, coughing, and at the same time, when you need to go, you need to go. And it can be so debilitating, to the point where I speak to patients who have this condition, and they're like, when I go out to a restaurant, anywhere, I'm like, where are the toilets? I need to know where the toilets are before I can feel safe. It's a lot. Now that you've heard about the 2 that I've mentioned, which one sounds like you? Urge, stress? Drop it in the comments down below. So why does it happen? So think about the pelvic floor like a hammock, right? It's a nice swing of muscles that hold everything up: the bladder, the vagina, and the rectum. And when you are pregnant for 9 months, you just put extra weight on that floor. And then it begins to get weak. So you have a vaginal delivery. The muscle on that pelvic floor just gets weaker because it's had to stretch really to let the baby out. But even if you don't have a vaginal delivery, the weight of a pregnancy for 9 to 10 months alone is enough to cause weakness to that muscle. And that's why it's really important to do your pelvic floor exercises. And I am doing them now. Every time I have done a video talking about the pelvic floor, do you know what happened? Automatically, I'm like, Remi, do your pelvic floor exercises. And I'm doing them now. You see, you can do them anytime, whenever. Once you add in hormonal changes, recovery, pain, trauma to the perineum, you can only imagine that that will all contribute to how the bladder could leak after delivery. And the really important signs to look out for are what I've alluded to already. Are you leaking when you sneeze, cough, laugh? Are you rushing to get to the toilet and then just before you go, you have some leaking? Do you find that you're just going to the toilet more often? or you're waking up at night to have to go to the toilet. That's increased frequency of needing to urinate or urinate in the middle of the night. We call it nocturia. Are you experiencing any of those? Are you feeling that even when you do go, the bladder just doesn't feel empty? It doesn't feel like you're passing a good enough stream. That could all be related to urinary incontinence. And if this is the case, it may well be time for you to see a gynecologist. And what they're going to want to know about you is, how many deliveries have you had, vaginal or cesarean? How many pregnancies have you had? When you had a delivery, did you have any injury to the perineum? How did that heal? Did that heal well? Are you having sex? Are you finding that sex is painful? Are you struggling to open your bowels? Are you having any leaking on opening your bowels? And like I said, that is also very possible, especially after delivery, and will be something I cover in a separate video. And before that, how can you be prepared for that appointment? Why don't you think about keeping something like a bladder diary? You're going to want to document when you're going to the toilet, how often you're going to the toilet, if you're having any episodes, what you're drinking as well. Because also it's not just what's coming out, it's what's coming in. Are you drinking 3 liters of water because some YouTube guru told you to do so? Are you not drinking enough? Are you drinking things like coffee, fizzy drinks, tea? Because all of those things are irritants to the bladder. When was your last drink of the day? Are you having 500 ml of water or Coke or juice just before you go to bed, and then it's no wonder you're up throughout the night? These are the types of things they're going to want to know when they see you in clinic. When they see you as well, they're going to want to do a physical examination. Because remember what I said about that pelvic floor? Not only could the bladder be weak or the rectum, but also the vagina. Are you having any prolapse or sagging within the vagina that's affecting your bladder? And then hopefully off the back of that appointment, they'll give you a plan of what you're going to do. Medication, physio, things like that. Very last resort, often last resort is surgery, but something that can be discussed, especially if you've completed your family. But what can you do in the meantime? You can keep a diary, like I've just said. You can try and spot the clues. You can think about what your drinking habits are like. If you're drinking 4 cups of coffee a day, try and holding back on that, reducing your caffeine or swapping out your caffeine entirely for decaffeinated drinks. And I know parenting is a lot, and sometimes you just need the caffeine to get you through the day. But how can you do it in a way that's also thinking about your bladder? Avoid late night drinking. And most importantly, do your pelvic floor exercises. The squeeze, the hold, the squeeze, the hold, the fast, the slow. Think about doing that. And I'll put an NHS leaflet on pelvic floor exercises down below. So if you felt that this video hit home and it's something that you're going through, or you know someone else who's going through it, why don't you share the video? Comment down below, subscribe to this channel, because I will have so much more content with you in mind. And please comment down below so we can have a conversation. I read them all and I'll reply to them all also. I've got a video on this channel about 7 lesser known postpartum symptoms where I do talk about urinary incontinence as well as other things. Why don't you go and check that out? And like I suggested in this video, I am going to talk about bowel incontinence because I think it's really important and it's something we don't talk about as often, but I will do a video on that, detailing what types of bowel incontinence exist and what you can do to seek help. Until next time.